My name is Ronel Golden. I'm a domestic violence advocate. And we have about 40 minutes to ask a few questions of these four leaders. And we are going to do a Q&A because I think a lot of you are here to ask questions or to figure out how you can get involved. So we're going to make time for that. We're also going to skip long introductions because I think most of the people here are known, but I would love for you guys just to mention your names and your titles.
Would you like me to start?
Please start.
Okay. Good afternoon, everyone. I'm Vince Tizzio. I'm the CEO of Axis Capital. We're a global specialty insurance company.
Good afternoon. I'm Nancy Brown. I'm CEO of the American Heart Association and the American Stroke Association.
I'm Quianta Moore. I am the executive director at the Hackett Center for Mental Health. I'm also a fellow at Rice University's Baker Institute and founder of Catapult Dreams.
And hi, everyone. I'm Lucy Perez. I'm a senior partner with McKinsey and Company, where I am the global leader of the McKinsey Health Institute. And Ronel, thank you so much for having us here for this conversation.
No, thank you guys for agreeing to be here. I think this is a great panel. I'm going to start quickly and immediately. What, in your experience, or in terms of your experience, do you think are the greatest issues when it comes to women's brain health? And at the same time, what are the greatest opportunities for us to address some of these issues?
I'll start. So I think one of the greatest challenges is that there's not an acknowledgement that women are not men, that physiologically we have physiologic and hormonal needs that affect our brain health along the life course. When you look at the brain changes that happen in adolescence after a young girl has her menstruation, those changes actually influence the fact that she has a higher rate of mood disorders than her boy classmates. When you look at postpartum and the perinatal period of time, it's another wonderful opportunity for brain plasticity, and with the right supports, we can optimize both structure and function and support that woman in her new caregiving role. But without it, then we end up having higher rates of mood disorders. And then think about menopause. where the hormonal disruptions that happen there and the decrease in estrogen really do, and progesterone really impact a woman's cognition and increases her rate of dementia, as well as cardiovascular disease and osteoporosis. And so the biggest challenge is that we actually don't talk about any of that. We've gone the entire day, in fact, without mentioning any of that. And so that is what I see our bigger challenge being.
And if I could add to what you're
Please.
saying, because I couldn't agree more, right? Sex-based differences, sex is a biological variable. You could argue cheapest, fastest to use in how we analyze data. And we've ignored it for too long with really dire consequences, right? And it is whether you're looking at the fact that treatments may not be as effective for women as they are for men, right? Or that women take a lot longer to get diagnosed. For example, if we think about schizophrenia, right? On average, it takes women 3 more years than men to get the diagnosis, right? If I think about migraines, 80% of patients, more or less, are women. And yet, existing treatments for migraines are much more effective in men than they are in women. And so you can start going down this list. And why this matters so much is that we often live in a world where we like making simplifying assumptions, right? Women live longer than men on average. That is true. So we assume that means women are healthier. But in reality, what the data continues to show us is actually women spend a lot more time in poor health. And that time spent in poor health is not concentrated at the end of life. It's actually primarily ages 20 to 60. And guess what? Brain health conditions make up about a quarter of that extra time spent in poor health. And because it is happening ages 20 to 60 primarily, it has huge economic implications because it's taking women out of the workforce, right? It's making women have to take more days to take care of their health. And also women are often the primary caregivers for those suffering from brain health conditions. So when we're talking about the economic impact, and yes, I'm someone who loves numbers and I may throw a few too many at this crowd, we're talking about $250 billion of economic productivity that is lost every year because we're not thinking about these sex-based differences.
And I might just pop in to say, absolutely agree. We have a saying at the American Heart Association, women are not little men. And when we launched the Go Red for Women movement for women and cardiovascular health more than 20 years ago, it was an attempt to solve all the issues that you all raised, as well as to help women understand, how to advocate for their own health, how to work together. But in addition to everything you've said, women are understudied. Science and research in women's health issues broadly, and certainly in brain and cardiovascular disease, are sorely underfunded, underrepresented. Treatments, as we've heard, that women are taking right now for any number of diseases are largely studied on men. And this is why they don't work as effectively on women. We do not have enough women in clinical trials. There are not enough registries looking at women's specific diseases. And, just until a few years ago, the only mechanical heart that was available did not fit in a woman's body. This is the truth until a couple of years ago. So these are the problems that we need to solve. And they're important and large problems that we must raise awareness. If women's health is not seen, at least on equal par, if not more, than men's health, to make up for all those lost years of women's health not being paid attention to, it will continue to see these dire consequences. The last thing I'll say is 50% of women over the age of 20, 50% of women over the age of 20 have existing cardiovascular disease. That's a problem we need to solve as well.
But we have to encourage women to solve that problem because, as we learned, they're not going to try to find help if something feels off.
That's
Okay,
right.
so that to me is a sign that women need to be educated about our own health as much as different industries have to come together to get women the treatments that they need.
That's absolutely right.
Okay, so now that we know that women are very tolerant of big problems, including pain and suffering, what are you doing within your organizations? And I don't mean your specific initiatives, but in general, in your organizations, what initiatives have you launched internally? What have you found to work well? What has not worked well? And how do you look at whether something is working well? It's a complex question, but
Yeah, I'd like to give the intersection to a broader narrative that comes from the discussion of brain health and women's health generally on this subject. And that's something that we have passion for at Axis, mental health. We think ultimately there's a symbiotic relationship behind how the manifestations of brain health, the focus on women's health, the methods and manners of bringing care, awareness, prevention, ultimately has an intersection with what we reason as a global epidemic in mental health. And whether it's born from geopolitical or geoeconomic uncertainty, or in the public sector as a public CEO that's leading a transformation through the stress and challenges that naturally come from those undertakings. And so we at Axis have brought our voice to our industry. And in the United States, it's a top 5 employer. It is a top 6 GDP provider to the economy here in the United States. And what we've undertaken is a campaign aimed at listening, learning, and sharing, trying to bring an intersection behind all the disciplines and bringing a provision of care that starts with the benefits that we as a public company provide our employees, making it responsive to the gender differences that we're learning about today and having for some reinforced. And ultimately, as we talked about in one of our pre-panel calls, and it's an honor to be with all of you, the stigma difference that's associated behind men and women and how they advocate their need for care. And so we're really passionate about the work that's being done, and we will continue to listen, learn, and share from all of you.
I would say there's a number of things we're doing at the American Heart Association to try to solve these problems. At the AHA, we're a US-based but global organization present in about 110 countries. And so we think about women's health across the world, not just in the US. And we think about it in the pillars of our work, like what are we doing in advocacy? What are we doing in science and research? What are we doing in communities? And a few of the things I might highlight, first of all, would be our role as as an investor. The AHA invests in scientific research, the second largest funder of heart and brain research outside of the NIH. And we've done a number of women-specific research initiatives. The Go Red for Women Strategically Focused Research Network is an example where we're studying things like MNOCA, which is a microvascular disease that is present in many women having heart attack symptoms. Those same women that come to the emergency room thinking they're having a heart attack and get turned away and say it's anxiety, go home. It turns out it's a microvascular disease that can cause a very serious heart attack in a woman. So we're studying really important issues. We're studying the impact of heart disease during menopause and pregnancy. So a lot of issues related to that. Through our Go Red for Women campaign, we have a registry, Research Goes Red, where we are engaging women to contribute their data, and we're answering the questions that matter to women, flipping the coin around. The things that matter most to women have to do with weight loss, stress, sleep. So we've conducted a number of novel studies using data from the Research Goes Red registry to study issues that matter to women. Our role as an investor, we've recently launched the Go Red for Women Venture Fund, which is a $75 million fund focused on women-specific health solutions that can be commercialized. We made our very first investment recently in Neura Health, which is a neurological-based health tech company, virtual care platform. 60% of their clients are women. We're very interested in focusing on the impact of migraine in brain health, and so that's a big area of focus. And then we also are having a heart and brain health tech accelerator coming up very soon. So there's many, many things that we're doing across the various pillars of work at the AHA to try to engage and partner with as many organizations as possible to bring these new solutions to life, to make sure that we're taking the dollars that we raise community by community, heart walks, heart balls, Go Red luncheons, all the things we do at the AHA to raise resources. We've got to use those resources to bring solutions to bear for the benefit of everyone, including women.
So in the several organizational hats that I wear, I'll say that kind of the overarching theory of change that guides all of my work is around trying to help target dollars precisely around the areas that will have most impact. And I believe, which is supported by lots of research, that we really need to start aligning our solutions, our investments around the physiological and biological needs of the population. And that's inclusive of women. And to take a two-generation approach, because we know that children don't exist in isolation. And there's strong correlation in the brain health of the mother and the brain health of the child. And so all of my work is really focused around increasing awareness of this lifespan, developing solutions, and then an evaluator for investors and philanthropic organizations so they can understand what impact looks like and how do we know when we get there.
And maybe to finish here with what are we doing at McKinsey? So I would think about this in three buckets for us. The first one is a very big role that we see in helping drive awareness by putting facts and numbers out there that hopefully help people particularly understand the business case around this, because I think the moral imperative, it's very clear, right? Understanding the benefit of the health outcome, it's also very clear. What often gets asked, can you show me the ROI? And so we hope that some of the data and tools that we're making available help make that another obvious thing. Of course, we have that too, right? So there's that whole element about how can we enable greater awareness around the opportunity that is here, right? That not only do we have healthier members of society, right? Healthier communities, but also stronger economies. The second part is partnership for action. Everyone has a role to play, and anytime that you're driving something as big as this, you can't do it alone, right? So several of the partnerships that we're very excited about being involved in, with many that are also in this room, one is the Coalition for Mental Health Investment. Nancy, you alluded earlier the criticality of raising and driving greater financing in this space. So that was for us really important to be one of the founding members there because this is so critical, right? When we look at the amount of funding that's available today and how much that needs to change. Also with the Healthy Brains Global Initiative, it is all about how do we make more, not only data about understanding what is happening right now, but the effectiveness of existing interventions, right? How can we catalyze the sharing of best practice and knowledge around what's working really well so that can be scaled more readily? And maybe one more to mention is the Brain Economy Action Forum, together with the World Economic Forum and many of the groups here, to really make the case of what are we talking about when we're talking about the brain economy and what's the roadmap to realize the massive opportunity there. We are, of course, an employer, so what are we doing for our own people, right? And so our program is called Mind Matters, the umbrella under which everything we do falls. And I would say two primary things. First and foremost, making sure that our colleagues have access to great care, right? There are different types of resources for them and their families. But the second one, in building Vince and what you said, is making sure we are destigmatizing. We recognize how much bias and stigma, and how are we training people to talk about things, to feel comfortable seeking help. And so normalization is a big part of what we do.
Okay, great. I think I'm going to open it up for questions now if there is anybody that has questions, because I think we have an idea of what everybody's doing and what their field of area of special expertise is. So are there any questions in the audience for anybody?
As George mentioned earlier, the Heckman curve of the investment early on in childhood. So just wondering how people think about that.
That's a great question.
So that's the bedrock of my work, is thinking about early brain development and how do you evaluate it? How do you create solutions that support the two-generation approach for both women and their children? And then how do you draw more funding to it? So for neuroscience, I thought it was interesting. There's a Nature paper that says only 0.05% of research in neuroscience is related to women. It doesn't go to your question necessarily, but women and caregivers are a really important part of that role. And so when we think about ROI, investing earlier is better. It's really the foundation and bedrock of the architecture. When you think about trying to develop solutions and investing in those solutions, you should really think about how do we optimize the brain, and that's through supporting brain health and brain development, the architecture of the brain, perinatally, in utero, and then the first 3 years of life. And then after we've maximized optimization, of course, because we know that mental health and brain health is a very complex process, and there's social, environmental, other sorts of factors that influence brain health. But then you start thinking about early intervention. And then along the continuum, after you've maximized your ROI on that, then you start thinking about disease for that population. But you think about it like a funnel, whereas we maximize population health in the largest way possible, then those folks who end up at the bottom of that funnel, who do have disease, who do need treatment, who do need very highly specialized intervention, then now we have more resources and investments to really optimize their outcomes and their returns. And so that's how we really look at, in the work, the early brain development model.
Are there delivery systems for that kind of support, though?
There's not, which is why you have a person wearing so many hats. Because I end up being in many different spaces trying to advise or create evaluation or create programs or policies to really help along this continuum to where folks really understand that holistically. That's why I love the brain capital movement. And my colleague David will talk about what we're doing in Houston after this panel. But it's really an opportunity for each piece of the pie and puzzle to unify together around a common goal of optimizing brain health, but we have to strategically understand where we fit on the continuum and how do we measure those investments and ROI along the way.
I might just add, not exactly aligned with what you were saying, but along the line of the question, what I think about and what we think about at the AHA is what are all of the touch points for young people, right? And so this idea of social, emotional health and well-being of the ecosystem around young people, whether it's parents, educators, persons in faith-based organizations, after-school communities. I'm really proud of an initiative that's part of the Alliance for a Healthier Generation, which is an organization founded by the American Heart Association and the Clinton Foundation over 20 years ago. And the whole focus of this is on the social, emotional health and well-being of teachers and professionals in schools, especially in under-resourced areas in this country. And the premise is that investing in that program will help, as younger brains are developing, if the persons, in that ecosystem are more aware and sensitive to how their actions and behaviors can enhance brain development early on, that may be a strategy to help with issues as persons age.
I have another question just as employers when you think about this. Can you include children in some of the programs that you're offering for your employees? Because if there is a mental health issue, what are the odds that potentially this is carrying over into the home? And how can you maybe even extend what you're doing?
Well, you can. You have to be willing to absorb the costs, of course, that relate to these additional services. And fortunately, this is a major subject. In our industry, for example, in the next 10 years, we have the chance of having 50% of the workforce retire. 50%. And those that are coming into the insurance industry, not the health sector, but the property casualty sector, is not nearly running at the same rate of the offset that's coming. And so it's not only good for business, but it's good for your employees to make certain that the provision of care we're providing to the families is equally met with the breadth of services. And as you listen to the answers to this question, can you imagine having a employee come to work worrying about their child in their own care? I mean, think about the burden that comes with that. In a global company like our own, we have challenges with employees. We have a teammate today that has a son that had to leave university for brain surgery. A rare diagnosis arose, and the provision of care, the benefits that we provide, gives our employee in this instance a lot of comfort, not only in the provision of being out for however long, but that the medical plan that we've provided is ample and covering enough of the variety of services that are going to be necessary for this young man in this instance to recover. So I think it's critically important to have that evaluation. And I think having dialogue like this and the work that the Clinton Foundation does as well is critically important.
One thing we've learned through our CEO Roundtable, which is a global collaborative of CEOs of large, influential organizations, is it's something so simple that gets overlooked so often, and that is making sure employees are aware of what's already offered. I think about our organization, and the benefits that we have for our employees. Some of these are really underutilized, even though they're paid for, they're available, and some of it may be related to stigma, but a lot of it's related to, do we take the time to explain, like, this resource means you could have this if needed. I think there's more of that could happen.
Can I offer a concrete example? So the Hackett Center is partnering with BP around an initiative to do more of this support. I think the question was like, how do you support children right in the home? And that support is by supporting their women employees who've recently had babies through our Brain Builders program, which helps to provide and reduce stress and helps to build what we call this social cohesion and collective efficacy and these other things. So employers have the opportunity to do a couple of things. I met Dr. Karp earlier, and he talked about his sleep device, which improves sleep for the female employees. But there's ways that employers can make things that we know are evidence-based and that work a benefit, right? As well as providing a culture around supporting women at these critical time periods.
So making the benefits available and making sure that the women are aware of it.
Mm-hmm.
And willing to use it.
Yeah.
So 3 problems. Okay. Any more questions from the audience? Red hair.
So I think this is a wonderful initiative, but I'm also very aware that in maternal situations, pregnant Black women are 300% higher mortality rate than pregnant white women in this country. So what measures are being taken to make sure that this isn't just about white women's brain health, and that we're considering the different type of brain situations that are addressing both people?
Can I answer that?
Yeah.
Or you want to?
Well,
Okay.
why don't you start?
Okay.
And then I'm happy to add.
So, thank you for raising that. So, Texas actually was one of the worst when it came to these disparities in maternal morbidity and mortality, and we formed a state task force. I was part Harris County, which has the Texas Medical Center, which is one of the best medical centers in the world. Also had one of the worst outcomes for Black women, and we formed a task force. We did research, we worked with hospitals, we found that there were a couple of issues around this situation or the reason why that was happening. One of them actually was implicit bias and women not wanting to access care. And so I think part of at least our work and what I think is really around being community informed, engaging community members, and building awareness around these issues. So for us, we took strategies in Houston, and this data scientist who's been tracking this number, the rates actually have gone down, addressing implicit bias in the hospital settings, as well as creating these algorithms and things for nurses to have early intervention and these other things and protocols in place. So it is a disparity for sure. But the root of it, a lot of it, if we were to boil it all down, comes back to this common theme that often women don't feel comfortable seeking care, whether it's for their pregnancy, whether it's for mental health, whether it's for menopause, whatever the issue is, women are not totally comfortable and confident in the systems and solutions that we have been able to offer thus far. So.
No, thank you for raising that question. We actually just published a paper looking at this particular question because it's one of the health metrics in the US that has actually been getting worse over the last few years. So Houston is an exception in that way, and probably we can tell why.
A lot of money on it.
But what it highlights, indeed, we also need to understand sex is not the only variable, right? So that is a key point. As we looked at this, right? By the way, there's also an economic opportunity associated. Again, it's not only the right thing to do. We're talking about $25 billion that the US loses out on every year. And that's looking at maternal mortality. But then think about the near misses, right? As I often like to say, and the implications that has, not only for the mother, but for those children, right? That then start life from a worse health state. So, but I think what I love about how you're answering this question, Quianta, is like, it also speaks to a place where it's not necessarily that is an innovation gap that we have a care delivery gap. We know what the interventions are. We know what needs to be put in place, but not always do we have examples like this one where you're thinking about all the checks that are in place to ensure that effective delivery of care, and that indeed the awareness is there around what resources are there, feeling empowered to speak up and say this is not normal pain, for example. And actually the whole space of pain is one where there's a lot of work that still needs to happen. But thank you for raising the question.
And I would add, just on top of all of that, which I completely agree with, we've done some strategically focused research on maternal mortality, and it's interesting to see, why is this happening to Black women more than others? And, underlying all of it, we agree, is the health care access and quality. And this is why advocacy for health care for all really matters. As we sit here today, looking ahead to 2026, when there will be, more expensive premiums for people who are in the health insurance exchange, the questions around coverage in Medicaid for certain populations. Like, we should be worried about this. It's going to affect health outcomes for many people, and I worry that it will make maternal mortality issues even worse.
Nancy, I just first of all want to thank you guys so much, you and Dr. Elkind, because so many people are diagnosed with a heart issue, but as we know, we're all still working desperately to have the brain be something that's recognized. And the fact that you've got a neurologist as your chief medical officer and all the work that you guys do is so incredible in this space, because I think it's like tying that whole body together, that heart and brain are connected. From a women's health perspective, and this prenatal and early intervention with children, I know you guys are investing in your whole new brain capital divisions, is there something particular we should know about that you're working on here? Are there ways that we all can help you with what you're working on there? It's just of huge interest.
Well, thank you. Thank you for that acknowledgement. And Dr. Elkin is amazing. Yes, he's incredible. And we're so proud to have him leading our scientific team around brain health. And what we know at the American Heart Association and the American Heart Stroke Association, what's good for the heart is good for the brain. You know, the risk factors for heart disease are exactly the same as the risk factors for stroke, cognitive impairment, and Alzheimer's. Largely, you know, there's the genetic questions, of course, that have to be addressed. And so we're honored to be able to take the investments we've made in advocacy, science, and research, and in the vast grassroots network of the AHA, 33.5 million volunteers and supporters here in the US, and about 40,000 scientific members of the AHA across a number of disciplines: cardiology, neurology, basic science, nursing, pharmacy, radiology. You know, this is the power of the American Heart Association. And we have to take these resources and help solve the problems that stand in the way of people having ideal health. And so it's our honor to do it. You know, we are in the midst of creating a new or enhanced strategy for our work in brain health. And although it's a bit early to unveil that here today, what I would say is that we intend to use the resources that I've mentioned across the various pillars of AHA. And an area that we're blessed to have the ability to lead in is this integration across specialties. So primary care, neurology, cardiology, nursing, because of our scientific structure at the AHA. And that becomes really important. You know, an example is we have a very large initiative in cardiometabolic health because, you know, cardiometabolic disorders, kidney disease, heart disease, all related. But when you're a patient, and you go to the doctor, you have a diabetologist, you have a cardiologist, you have a kidney doctor, you have a PCP, but how is it really coming together? And I think this issue of heart and brain is exactly the same. And that's a little sneak preview of what you can expect from us. Thank you.
I can take one more question, and I already promised it to the lady here that I saw. I'm so sorry that I saw first, but I think a few people will be available to take your questions afterwards. So please.
Early prevention, starting in the earliest possible moment. Clearly, pregnancy is a window of action, vulnerability, particularly for the mother and for the baby. And you realize that almost all of our 90 billion brain cells, neurons, were formed when we were born. Right. We have to protect that brain. And what research is showing, including my own, is that environmental and social stressors are really affecting early child development and their functioning, cognitive, behavioral throughout their childhood, adolescence, and even into adulthood. And that they may be seeding those neurodegenerative conditions that we've been talking about earlier this morning. So prevention, as Quianta has said, must start very, very early.
Before birth, basically, because it's about the diet of the mother. Yes. So I think one thing that I definitely took away from this is that if I feel anxious, go to the doctor. It might be something else. If like use the resources that I have to make sure that I'm keeping myself healthy and being preventative. Is there anything else that you want to say just as we wrap up?
I would say one thing.
10 words
If
or
you
less.
are in a position where you're asking a question about brain health, ask, are there sex-based differences in the answer to that question? Because we need to understand, is sex a relevant variable as it applies to this?
I would just say that for everyone in the room, you know, I was so impressed by the precision nutrition panel early, and along that continuum, we know that these physiologic sex-based differences and how food can actually mitigate and reduce some of the symptoms and problems. So I would just encourage everyone to consider these sex-based differences in your investments, in your work, and the solutions that you're coming up with. I mean, women are half the population, and 100% of them will go into menopause. So
There you go. That's a big statistic. I'll answer this a bit differently. I think we need to continue to inspire women to advocate for themselves, for their sisters, their mothers, their friends. You know, we've got the system has to meet actual people, and women need to know it is okay to demand outstanding care.
To take action.
Be a change agent in the advocacy and the destigmatization front as much as you can, because I think that is a real challenge that I observe in our workforce around the world.
Thank you guys so much. I really
Thank you,
appreciate it.
Ronel.
Thank you so much.